In 2014, Regional Director Dr. Poonam Khetrapal Singh identified Unfinished Agenda, Ending Preventable Maternal, Newborn and Child Deaths, with a focus on neonatal deaths as a regional flagship. Focused efforts followed, with WHO and countries formulating and implementing strategies and frameworks to strengthen national maternal, newborn and child health and family planning initiatives. The emphasis was on promoting evidence-based measures to reach all people in need, not leaving anyone behind, improving quality of care at all levels of care, strengthening data systems to measure implementation of strategies and frameworks, as well as gaps in the programs for further corrective measures. The region witnessed strong commitment and investments by governments and concerted efforts to expand population-based coverage of essential interventions for reproductive, maternal, neonatal, child and adolescent health. Building on the collective movement to end preventable deaths, the region focused on good quality services that are respectful and recognize the dignity and rights of women, newborn and children as an essential element of universal health coverage. WHO and partners developed and implemented a point-of-care quality improvement approach in 2016, one of the key initiatives to accelerate reduction in maternal, newborn and under 5 mortality and reduction in stillbirths. Additionally, to address birth defects to further reduce neonatal and under 5 deaths, in 2014, an integrated online platform was launched for hospital-based surveillance of newborn deaths and birth defects. A year later, a regional framework for prevention and control of birth defects was launched to help countries plan surveillance, prevention and treatment of birth defects, to reduce deaths and disability in newborn and children. To strengthen the care of preterm and low birth weight babies and their mothers, including Kangaroo Mother Care Approach, KMC, WHO promoted zero separation between mother and newborn right from birth. India innovated Mother Newborn Care Unit to accommodate the mothers in the newborn unit for better care for small and sick newborn through early and prolonged KMC, while other countries also expanded the implementation of the regular KMC. Rapid and equitable expansion of evidence-based interventions, enhancing quality services at birth, preterm care, and strengthening management of pneumonia and other childhood diseases were among key measures taken to reduce neonatal and under 5 deaths. The region eliminated maternal and neonatal tetanus as a public health problem in 2016, and countries made impressive efforts to enhance routine immunization coverage to protect children against life-threatening but preventable diseases. These initiatives added to accelerating efforts to reduce maternal, under 5 and neonatal deaths. To strengthen maternal health, WHO supported countries in the region to adopt institutional delivery and quality of care at the time around childbirth and scale up maternal death surveillance and response system, MDSR, a key quality improvement approach to enable identification, notification, quantification and determination of cause of deaths with the goal to reduce preventable deaths. MPDSR was later introduced with perinatal component to include review of stillbirths and neonatal deaths. With family planning interventions known to reduce maternal, newborn and child deaths, WHO-oriented countries on updated evidence-based guidelines. The countries have expanded the family planning programs and the region has achieved the related SDG 2030 target already. WHO has supported countries with latest recommendations and tools to expand comprehensive abortion care, as unsafe abortions contribute significantly to maternal mortality and morbidity in the region. As the COVID-19 pandemic impacted RMNCAH services in the countries, WHO and partners carried out surveys to assess impact and support with appropriate strategies. Digital health interventions were tapped into to continue services such as consultations for antenatal care and postnatal care. The decade was marked with unprecedented efforts by national governments WHO and partners, health workforce, and matching results in maternal, under 5, and newborn health across the region. Between 1990 and 2015, the region has witnessed 69% reduction in maternal mortality. Bhutan, Maldives, and Timor-Leste were among the only 9 countries globally to achieve MDG target. In the same period, the region registered 45% reduction in under 5 mortality. With a targeted approach under the Flagship, the subsequent years saw further rapid decline in maternal mortality and under 5 mortality death rates. Between 2010 and 2021, the region recorded 39% decline in child mortality, and 5 countries, DPR Korea, Indonesia, Maldives, Sri Lanka and Thailand, have already reached SDG target for both the newborn mortality and under 5 mortality rates. 4 countries, Bangladesh, Bhutan, India and Nepal, are on track to do so. Maternal mortality has reduced by 69% compared to 1990 baseline, the steepest decline globally, and stillbirths declined by 54% in the region. 7 countries, Bhutan, DPR Korea, India, Indonesia, Maldives, Sri Lanka and Thailand, have achieved the 2030 stillbirth rate target of 12 or less per 1,000 total births. Countries have made remarkable progress in maternal and child health. Our efforts must be further strengthened to ensure equitable access to quality services to further reduce preventable deaths.